Good afternoon, I'm Dr. Madhuri Khilari, a consultant neurologist and epileptologist at Apollo Jubilee Hills, Hyderabad. And today I'm going to talk a few words about what the condition epilepsy means. So all of us know that epilepsy has got to do something with seizures. But the important distinction between epilepsy and seizures is seizures could be a one-time event. Somebody who has had a seizure does not mean that that person is predisposed to get epilepsy. And generally seizures can happen with small triggers like fever or some alteration in the body salts like sodium levels in the body. So when a person has some abnormality in the brain, a person can develop recurrent seizures, which could be different from having one-time seizure. And this condition is called as epilepsy, wherein the seizures happen without an obvious provoking factor. Somebody who has an epilepsy, there's nothing to be daunted about it because it's a very easily treatable condition, and 2/3 of the cases of epilepsy do attain a complete seizure freedom based on medications alone. Now there are another 1/3 of the patients who may not get a complete seizure freedom with medicines alone. And again, the good news is that these people can be, with the advanced medical therapeutics, they can be managed very well, and some of them can attain a seizure freedom with the new seizure medications or with the new treatment facilities available. So some of these could mean undergoing an epilepsy surgery. Some of these could mean undergoing some neuromodulatory treatments. So if you think that your seizures do not get controlled well with 2 or more adequately tried medications, please get in touch with a neurologist with an expertise in epilepsy, and will definitely help you in getting or attaining the seizure freedom. A few more words I would like to talk about is managing seizures in a patient who is actively throwing seizures at that time. So the first aid in epilepsy basically. So whenever you see a person having a full-blown seizure, the generalized, you could have seen people throwing violent convulsions, jerky movements. And what do you do in these circumstances? So the first thing is to avoid getting panicked, be calm, see to it that you bring the patient in a safe position at a safe place, keep the patient in a sideways position. There are certain do not do things like do not put your fingers or any objects in the mouth. Do not give any objects like metallic objects in the mouth because it's of no help. And another important thing is keep recording the time. See for how long a patient is throwing a seizure. If it's exceeding 5 minutes duration, then please consult the emergency. Do not stop the medications in any circumstances. Take regular medications. Have proper sleep. Have a healthy diet. Avoid alcohol. And keep a seizure diary. So these things are paramount in keeping a track of your seizures and also seeing that you also help yourself in attaining a good seizure control. So if you have any doubts about epilepsy, please get in touch with me, or you can come down to my OPD at Apollo Jubilee Hills. Thank you.